After 15 years of teasing Americans, saying, oh, we're going to have our health care plan any moment now, any day, any second. Oh, it's going to come. Don't you worry. We're on the verge of it. Oh, we're so close. Just go one more time. Republicans have finally released what they're calling a health care plan. Now, it's not actually a full piece of legislation that just remakes the American healthcare system the way the Affordable Care Act, aka Obamacare, did. It's actually, I guess, to use Trump's own words, it's concepts of a plan. And as hundreds of millions of Americans will await their insurance premiums increasing at the start of January, Republicans, with their concept of a plan that has been introduced in the Senate, have come up with an idea to make your insurance premiums go even higher. Yeah, that's their plan. Premiums are already going to go up. And if the Republicans pass their legislation, they're going to go up even higher. The piece of legislation was put forward by Republican Senator Bernie Moreno from Ohio. And it's the Consumer Affordability and Responsibility Enhancement Act, or CARE Act, because he cares. That's so cute. I love how they come up with these fun little acronyms, because it's the CARE Act because we care. The law would get rid of $0 monthly payment healthcare plans for very low-income people. So nobody's going to get a $0 plan. It's going to phase out the Affordable Care Act subsidies that were increased by Democrats during the COVID-19 pandemic. And by the way, increasing those subsidies during COVID, which they're still going right now, allowed 24 million additional Americans to be able to purchase health insurance. So we can use that, logic to assume that once these subsidies phase out, or the extended subsidies phase out under Moreno's plan, 24 million people will straight up lose their health insurance. So we're getting rid of subsidies, getting rid of $0 plans, which means everybody will have to pay more out of pocket for their health insurance, so the premiums go up, and at least 24 million people are immediately at risk of losing their health insurance. That's the Republicans' plan, folks. That's it. That's the thing. Well, that's not it, because it actually gets worse. The law would also phase out subsidies for high earners. Once household income hits $200,000, the tax credits no longer apply. The bill also aims to end $0 premiums and would require a $25 minimum monthly payment to limit fraud and abuse. $200,000 in the year 2025, heading into 2026, is actually not a lot of money anymore. 10 years ago it was really good income. 20 years ago it was, holy hell, you guys are living the high life. But not anymore. Yes, most American households do not even make $200,000 a year. But with inflation, with the rising cost of homes and cars and all of that, $200,000 does not get you very far depending on where you live in the country. And now those people who are not able to, live the high life and fly first class and all that, they're going to lose all of their subsidies. So everybody getting healthcare through the healthcare exchange is going to see their out-of-pocket expenses go up to buy plans that are going to increase in cost this coming January. Now, let's not forget, it took Republicans 15 years to come up with this plan to make you pay more for health insurance. 15 years. I can't think of anything more pathetic than that. Scientists recently discovered a new evolutionary trait in puppies, and it's that they cannot grow up and reach their full potential unless you subscribe to this channel. Don't do it for me, folks. Do it for little Atlas and Judge here. Good boys. You do good. You want to say something? No? Okay.